invited by our planning and funding department to a telehealth project demonstration meeting, and I heard what was happening with our mental health colleagues and how they were using telehealth with the coast clinics. When I heard that Ngāti Porou Hawora were fully invested and involved in telehealth and really wanted to make a go of it, I started to go away and think about how we as a department could make that work in long-term conditions. So by working alongside our colleagues up in Ngāti Porou Hawora, we came up with the idea of doing some long-term condition clinics. We decided to start small, so we started with one service that was diabetes. That seemed like an easy one to start with because everybody's already committed to working in a different manner to look after the needs of our diabetic population. So last week we set up a few clinics for our diabetic nurses here in Tuitiora to connect with some coast clinic practice nurses. We had some patients along and managed to do some really great consultations and work out management plans with the diabetes nurse and the practice nurse involved. The next stage of this is that we extend the project so that it's not just the diabetes nurse sitting here in the hospital room, but maybe we have our dietitians come alongside, or our podiatrist, and he has some input into what's happening in the wider management plan. If the patient also needs assistance from, let's say, the heart failure nurse specialist or the sleep apnea clinic, we get the right people in the room here so that the patient just comes to one appointment at one of the Ngāti Porou clinics, and all the people from Tairāwhiti District Health are here to be able to be engaged with them in formulating a management plan for their ongoing benefit.
We've been using telehealth more recently as part of our Okati Paipa quick coaching service, and we have two quick coaches down in Gisborne that have quite a large area and population to service. One of the things that they have been doing is linking with the local clinics up along the coast and doing quick coaching sessions over telehealth. There's been some very positive feedback from that.
Why I think telehealth will be beneficial to us is driving 2 hours up the coast to see one client is a bit of waste of our resources, so just using the kaiawhina that are up the coast and setting up appointments so we can one-on face-to-face with a support person. So I'm really keen and excited to be a part of the telehealth trial and look forward to what it can bring to us next year.
Where we work is very isolated. We're about 2 hours from secondary care, so the use of video can be hugely benefited in providing better care to our patients. I work mainly in the community, so doing a lot of home visits and very complex conditions with very limited resources with 2 nurses and 1 doctor. So our assessment skills have to be pretty good in the community. In regards to the video, there is a huge need for it in the community, a huge need for telehealth and in a way to benefit patients and be provided with the specialist care when needed, as it's very isolated.
Yeah, so it involves just general medicine stuff, following up patients who need to be followed up and seen by the doctors, linking in with the doctors if it's a nurse-only day at Te Puia or maybe Ruatoria. Often having a permanent doctor in this area is not always that easy.
Ko taku mahi he nehi, e huri I te reo tuarua. I'm the rural health nurse. I work here in Ruatoria. We have been privileged to receive telehealth, and telehealth is going to help link us to all the areas within Ngāti Porou as well as to specialists in other fields. I work with well child, I work with cervical screening, I do all the palliative care, I am in the community as the rural health nurse, and so therefore I have to network with people regularly. There I come into the clinic and I work alongside the GP. This special camera will help us to be able to liaise and get expertise and specialist attention to help us in our work. The people will have at hand the opportunity to be televised and to aid myself and the doctors and the practice nurse with cases that are difficult, and to be able to zoom in on the case and get help where we are. Point-to-point care is just probably the best care we can receive. So telehealth will help our community and our people to get that care at their doorstep.
We had a trial telehealth conferencing between the clinic here and Tuiti Ora, which is a hospital 1.5 hours away, with the diabetes clinic. So this trial consisted of just with the nurse specialist and the patient who has a long condition of diabetes. And on that particular day, because it was a trial, we organised for 2 patients to come in. And it was quite a successful day. The reaction of the patients afterwards was all positive, and they enjoyed the experience. There were goals set with the nurse specialist, and yeah, there was positive outcomes on both sides. The patient said, well, is this technology, is it going to be leading to where, you know, I can have the specialist and the nurse specialist at home, you know, like Skyping. So we thought, oh well, there's the capability of that to happen. In the short term, I see this technology as being very beneficial for all parties, especially for the patient with long-term conditions. We have a lot of barriers here on the coast in regards to, you know, patients' financial stability, transport to and from health appointments. So having this technology here in this in Ngāti Porou Hauora will be of great benefit, and I'd like to see it succeed in the future. Last week I saw a patient, and she expressed that for her to have this operation, her specialist recommended for her to lose weight, and she said that dietitian input would be great, but wouldn't be able to afford the trips into town to see a dietitian. And I briefly discussed about the technology that we have here on the coast, and if she could speak with her specialist in town, whether there could be a referral made to a dietitian. The dietitian could use the telehealth technology they have at the hospital. We could link her up here at her local clinic and make that connection with the dietitian for her to achieve her goal. For her to be able to see the dietitian, this will enable her to improve her health, for her to undergo this operation, and she will no longer be in pain. So this will be a life change for her.
Living rurally on the East Coast always has the challenges of our roads, and with telehealth now, it is one form of solution in making access to whānau that we care for on the East Coast. What telehealth in the video means is that it takes away the difficulties that a number of whānau have in getting access to our service. And all that means is that a simple appointment can be made at a woman's local community health centre with the midwife, where we can discuss a breastfeeding issue, which will mean the long-term success of breastfeeding until such a time I can get to a home visit, which will be fantastic. Another reason why I think telehealth is vitally important is because of the isolation as a health professional. It will allow the ability for me to link up with other professional networks, which will also be very helpful in my own professional development, whether it's to discuss particular cases or whether it allows my attendance at meetings, which otherwise I'd never be able to attend or have difficulty in attending. So in that respect, telehealth will once again enhance the maternity services on the East Coast.
Up on the East Coast, we're quite remote in the sense that we are an hour and a half outside from Gisborne going northeast. One of the issues is being able to see patients in real time, able to know exactly what's going on with them and how they can get the best possible care. Sometimes it's been to stay on the coast, and other times it's to have them transferred. The beauty of telehealth here is that it affords us quick visualization via our clinics with our nurses, and at the same time also an interface with Gisborne Hospital because they can see what's happening here. And then that actually also helps us, if needed, transport them through to tertiary centers. Now the outreach clinics that have been created are actually really good. One of the reasons is because initially, if our patients are seen in Gisborne Hospital, they can actually be followed up after that, as long as there's no concerns via these clinics, diabetics, those with hypertension, renal clinics, dietary clinics. It's really good because what that does is, one, it saves on cost. They don't have to travel all the way to Gisborne. Some of them are coming from as far as Potaka, which is 2-3 hours from Gisborne. And that affords the specialists also to be able to see them, and they can actually talk to the specialists about their concerns and not have to worry about other problems. So it's a good way to, one, to reduce the costs, to improve the kind of care they get, because a lot of times we get a lot of DNAs because patients can't make it into town. So that's one of the other really good things about the outreach clinics, and the hope is that as we get it running, it'll be a much improved service that we can rely on. The job satisfaction is always going to be there. First of all, you've got to be a particular kind of personality to work here. The neat thing about the isolation and having these health clinics and having everything the way it's set up is that it affords you to see rural medicine in a really special way. It also affords you to use things like telehealth to actually link in with specialists on the other end. Because a lot of times we don't have to send our patients away. A lot of times we can talk with a specialist in Gisborne and maybe hopefully Waikato in the future and actually discuss things and actually probably manage them here and only send those that are really needed, that really need special care to further centers outside. So the satisfaction is always there because of what we learn on a daily basis is actually the key here. It's every day you learn something new. It's one of the things about working here.
I am really excited about what this telehealth affords to both Tuiti Ora and our clients on the coast at Ngāti Porou, Hauora. It is a wonderful tool to be able to communicate due to limited access that the clients on up the coast have. So just being able to speak with them face to face without making the travel up the coast will be beneficial to both the client, well, especially for the client.
Really, when it comes to this kind of technology, there is no limit to how we can use it. And I think that we've spoken before about the fact that we can use this for the development of staff. So we can have one-on-one or group meetings between the staff in different locations to be able to talk through clinical issues or give development and learning. We can also use this for a wider range of patients and a wider range of specialties. I would imagine that the outpatient department here with some of the medical practitioners or even visiting specialists who come to Tairāwhiti District Health from Waikato or other areas might be able to use the video outreach service to be able to see patients on the coast clinics, much more convenient for the patient, much better for the staff here. I think as well we might be able to start doing some video outreach clinics with Waikato. So the clinicians will actually stay over in their tertiary DHB and we can interact with them here. I think there'll be even things that we haven't thought about yet that we'll be able to use the technology for, and I'm just excited to hear what people around the rest of the country are doing, and we'll think, that'll be great for us, let's have a go.
It's an answer to a prayer for this region. In this region, as you will be aware, Tairāwhiti is a long, elongated area. We have lots of patients who are many kilometres away from accessing either their clinic or, more importantly, their tertiary centre. So the ability to be able to have a much shorter distance to go for a consult is amazing, unbelievably amazing. And a good example would be, already we have patients who are involved in the mental health field, and for those people it means instead of having a 5-hour trip, they actually only have to maybe make a 20-minute trip or a 30-minute trip, and they are going to receive exactly the same service. That's the best part, the same service, but with less inconvenience to them. And also from our point of view, it's much more efficient. So instead of having a clinician travel from here to Tapuia and back again, they are able to actually work and see more people, because the downtime which they would have normally travelling there and back is actually used in consulting. I see a huge future in it. So the follow-up procedures or the follow-up clinic in actual fact can be video health. Excellent, because it means that the patient once again doesn't have to have, if you're right at Matakawa, a 3.5 hour drive perhaps, and a 3.5 hour drive back maybe, it means that the clinician can do the follow-up with the video health, because it really is, the questions, as you know, the questions are, well, you know, how are you feeling? Have you had any discharges from the wound? In fact, the clinician can have a look at the wound. So the nurse that's in attendance there can actually prepare the patient, and the surgeon can have a very good close look at the wound. In fact, he can examine the stitching, he can examine the clips, he can find out whether the healing process has been done well without all of this travel. It is an amazing concept, and our board is working extremely hard to promote it and to work with it in every area. And the one other thing I must mention is also the business of clinics interacting with other clinics. So that's another great thing. So we have a team of doctors at Tapuia, and we have an isolated GP at Matakawa, at Te Araroa, and so they can communicate about a patient. And in fact, the doctor in the hospital at Tapuia can actually have a look, and if it's a skin complaint, they can have a really good look.
So back in October, some of the team here from Tairāwhiti, alongside the project manager for the Telehealth project, travelled up to the coast clinics, and we had a meeting with the clinical staff and the management staff. All got round a big table and talked about what we wanted for telehealth, heard what the staff in Ngāti Porou wanted for telehealth, and then worked out a plan of how to get everybody's needs met and work forward. And I think that first face-to-face meeting was really valuable. It helped us to be able to make sure that we were all on the same side, working for the same objectives, that we were all at the same point in our development of how we wanted to use telehealth. But also gave us the opportunity to talk about how it's been used successfully in other areas, and not feel that we're the first people to try that. Look, it's worked for somebody else, so let's give it a go for us. That meeting was of huge benefit. We were then able to take that and build on it, and not let the momentum subside. So I think we left it 2 weeks, and then we had our first telehealth clinics. I think that's the key, is that whilst there's staff engagement and enthusiasm, to be able to get moving and take the project forward.
We're pretty excited about the role of telehealth, that it's a way of bringing the two services closer together, that we can actually see in each other's workplace, and people are going to be less isolated. And I think for us it's particularly seeing the acutely ill patient, and that helping us to make decisions on how we manage that patient together with the doctors that are in Tapuia. And we had a good example recently where we missed that opportunity, but the advantage, of course, is that it's allowed us to learn and can see how we can do that differently. And this was 2 girls who'd been injured in a car crash, where if we had chosen to use telehealth and we'd seen that and then had a discussion, we may well have decided to transfer that person earlier. So I think it's going to be a big thing for acutely ill patients about the decision to transfer, or conversely the decision to keep them in Te Puia, and to give advice about how they might be able to treat that patient. And the next step is now, rather than using it very occasionally as a special occasion, is for it to become business as usual, for us to become as comfortable with telehealth as we are with picking up the phone.
I was tasked with the duty of putting together a mobile unit for our primary healthcare manager, Georgina Pairata. So what I did is I went into one of our houses and grabbed an old trolley that had been decommissioned for so many years. I grabbed the pole off one of our old fans, got our maintenance men to put it together for us, ordered some new IT equipment, and we were lucky enough to get a camera from the project, and yes, and I put it all together, and I think I did a really good job of that.
Talking about telehealth today and how it impacts on our life. We're rural, we're isolated, we stretch over around 300 kilometres, maybe a little bit over. We're in an area that is, has small scattered populations. Having doctors coming into the area and having the ability to get feedback from anywhere in New Zealand also helps support ongoing learning, training, clinical review for all our doctors that come here. So really those are the two things. It's access and opportunity for us to really be part of the rest of the world.
It's going to open a lot of opportunities for our users. We've had some recent experiences where we've held the specialist clinics, and instead of our whānau having to travel from the top end in Matakawa to come to the Te Puia hospital to see the specialists, they've been able to remain in their clinic and be supported by their local nurse. And like this week, we've had the helicopter go out 3 times just in the last week. So it'll certainly help with, ensuring that by the time we transfer our patients out of here, the clinicians in A&E will also have had the opportunity to sight the patient, and that'll actually improve that relationship between our clinicians. And so we're looking forward to that time. We will be making great use of the facility.
I can go back to the 1980s when we were talking about what could we put in place so the nurse up in Te Aroha, which is the most distant of our clinics in the East Cape, how could she link with the clinical staff at the hospital? And we're looking forward to the opportunity to enhancing our service delivery, particularly around chronic care, the management of chronic care patients, where we can hold outreach clinics, and from that we would coordinate with TDH and clinical team, and together arrange these outreach clinics, and people from any one of these 6 outpatient health centres to engage with a specialist team. Now, to me, that's really, really exciting. And our people will become more and more familiar with that approach for their service delivery in the future. And it's for staff within Ngāti Porou becoming more familiar, being very comfortable about another way of helping our people.
Telemedicine's growing on us. We've been using it for relating to consultants, and a nurse from the other clinic used it with me 2 days ago. She had an injury and she used a close-up with the camera on the injury, and we could tell what needed to be done. So she could send it up, and rather than just manage it, we had to stitch that wound. It was a big gaping wound, but it was good to view it before it arrives. So for skin things, it's really excellent. We're starting to use it well. So it will be a good, valuable tool in the future. And some of the times when we're not at clinics, nurses can use it very easily with us. So I see a good future for telemedicine.
Across the health profession, there's a huge appreciation for those that work remote rural. So making that sort of accessibility to us as rural health professionals via telehealth is very appealing. It's moving with the times as well. It's the use of technology in order to improve our service, because we can get quite resistant to change as well. So, and time will tell. You know, this time next year we'll be able to see whether this is a service that becomes part of everyday life for the communities as well as for the health professionals.
Of course, we've talked about how this is going to work for the staff involved, but let's not forget that actually what really matters is the patients and whether they find this acceptable and whether they're going to get benefit out of it. So we used a feedback form, and after our first clinic, one of our very first patients had some feedback for us that I'll just read. The explanation was clear of video outreach. I participated with great interest for any knowledge that would be helpful tomorrow and the future. We talked about being a diabetic, food, alcohol, blood pressure, weight, cholesterol, relationship stress, financial stress, minimum wage, and how I've dealt with all these things, medication and then ideal range. Last of all, there's a way to increase insulin in the pancreas, other than cinnamon and cayenne pepper. The video outreach is a great idea that's been put into action, along with our doctors, Shirley and Lisa, and all I need is them to keep me motivated. What a wonderful professional medical team. So I think that probably shows us that this is going to work for our patients.
What's it like getting health services here in TRI?
Sometimes slow. You wait for the next day. You wait till it's open. Yeah, especially in the weekend. Otherwise you ring the ambulance yourself and you go to the hospital. Hey, we know when the doctor's days are and we know when the nurse's days are. So there you go.
Nō reira, ko te Telehealth pia he tikanga hauora anō mo te ao hurihuri, nō reira, tēnā rau atu koe mo te mātakitaki mai, mo te whakarongo mai. Kia ora.